The ACL, which is short for anterior cruciate ligament, is a ligament right in the middle of the knee, and it can be injured or torn, mainly with athletic injuries. All athletes are at risk for an ACL injury, but in general, sports where you're cutting or twisting or changing direction, those are the athletes that are most at risk. In particular, if you're trying to slow down, plant your foot, and change directions all at the same time, that particular mechanism is very prone to producing a torn ACL. Soccer is a very common sport for tearing an ACL. Basketball, football, anything where you're typically running and then changing direction quickly will put you at risk for tearing your ACL. When you first injure your knee and it's torn the ACL, it's very painful and swollen. You're usually unable to continue participating in your sport, and you limp, and it's quite disabling. That will go away. Many times a few weeks after the original injury, your knee will function and feel pretty normally for day-to-day activities. But if you're trying to live with an ACL deficient knee, a knee that's previously torn the ACL, it's prone to buckling or giving way. After an athlete tears their ACL, they need to be examined by an experienced examiner, and most experienced examiners can examine their knee and tell that the ACL is torn. But the test that typically proves whether it's torn or not is an MRI. The ACL can be treated both surgically and non-surgically. If you're a so-called low-demand patient, if it was kind of a freak accident and the type of activities that typically provoke symptoms from a torn ACL are not common to you, then we will many times treat people non-surgically. But if you're an avid athlete and if you regularly participate in competitive sports that require cutting, twisting, side-to-side movements like soccer, like football, like basketball, then almost always you'll want to get your torn ACL fixed surgically so that you can continue to participate in those sports. To treat a torn ACL surgically, it needs to be rebuilt with a graft from somewhere else. Unfortunately, it cannot be sewn back together or repaired. So the ACL reconstruction involves taking a graft from somewhere else and drilling tunnels through the bone so that they enter and exit the knee exactly where the ACL used to begin and end, and then placing the graft through the tunnels to actually rebuild or replace the torn ACL. Recovery from an ACL reconstruction is fairly prolonged. It's about 6 months for most athletes before they return to their athletic activity. Early on, the patient's in a brace and on crutches and is fairly limited by the surgery. But gradually, as the pain subsides and their movement improves and their muscle tone returns, then they're able to get off crutches, get out of their brace, gradually increase their strengthening and conditioning with the help of physical therapy, and gradually return to drills for sport and ultimately their sport.